It seems to have been an unfortunate set of circumstances, basically, where the timing of each new awareness around the severity of the illness itself was coming, just a half step behind the ship and its progress. There was a notification that was sent to Vanuatu health authorities that numerous people on board the ship, some of them crew members apparently, were reporting influenza-like illness and acute respiratory illness. Now, that's a red flag, and any one of us who heard that today would, needless to say, be shocked and quite concerned. At that point, there were instructions sent that these people should self-isolate, that they should not disembark and whatnot. In the course of all of this, what happened was that one of the passengers who later tested positive for COVID-19 did, in fact, disembark on the first day that the ship was in Vanuatu waters. Now, that night, another instruction was sent where the people were told that nobody should disembark from the ship. And sad to say, this person had already been on the island for about 2 hours earlier that day. And the thing I think that's most troubling is that it's very, very difficult to see how this came about, how the decision to allow the ship at all came about. Days later, they blocked the very same ship from arriving here in the capital, in Port Vila. And second of all passengers were asked to present themselves if they were feeling ill in any way, and this apparently didn't happen. Either the person was not feeling any symptoms, or they decided to hide them, and that's quite concerning as well, as you can imagine.
Indeed. Now, how have authorities responded in terms of how they are trying to manage that, and also, of course, how a country that size and potentially vulnerable copes?
That's another matter of real concern. As near as I can tell, the first formal confirmation from the cruise line that a passenger had in fact disembarked, who later tested positive, came about on the 25th. And prior to that, we knew that the ship was there. We knew that some of the passengers were positive. We didn't know whether actually there had been contact. So a contingent was sent down on an emergency basis. They did interviews. They tested. They looked for people with symptoms. They didn't find any, but as a precaution, they took a number of samples, I believe just a little under a dozen. And the really good news is that all of those samples came back today, and they've all tested negative.
That's good news. Now, Dan, of course, people I know are dependent heavily on the media to keep them up to date with the development of this virus. You're struggling because there are quite a few media restrictions.
Well, these were just announced today. The intent of the government seems to be that they want to clamp down on false information, on rumor mongering. And in fairness to them, there has been a certain amount of rabble-rousing, especially around the Vanuatu National Provident Fund, where people have been asking to be able to withdraw some of the money that they've deposited over the years in order to tide themselves over the difficult times ahead. And as they say, the medicine seems to be worse than the illness itself. What they've done is they've said that any media outlet publishing any story relating to COVID-19 is required to seek approval from the National Disaster Management Office, and they are to work in coordination with the WHO. Now, there are innumerable examples of stories such as this one right here, which don't really touch on the health side of things. They touch on just trying to establish the facts around a particular event that are straight-ahead news stories, and I'm not sure why we should be asking anybody for permission. It's quite uncertain right now, and I expect we'll see some clarity and probably a working agreement over the next few days. But in the short term, we're really concerned about any kind of overreaction. And so when we saw this, that got this instruction that was gazetted today, it was quite concerning.
Indeed. Australia, of course, is struggling to contain the fallout here. It is a critical partner in the Pacific. How critical, again, is it going to be for us to step into the breach if nations there are affected?
Well, I'm on the record. I wrote a piece a little earlier this week for the Griffith Asia Institute that argues that Australia has, they're support of the Pacific is a strategic necessity. For one, they need to keep their own borders safe, and if they have infected people coming from the Pacific, then, it'll only increase the risk to the nation itself. Second of all, they've got to maintain their position, their geopolitical position in the Pacific. That doesn't change just because we've got a global pandemic on our hands, pardon me. And so, if China were to take this opportunity to become the white knight in the Pacific, lavish the region with assistance and aid and whatnot, if they were to send ships down, for example, to, hospital ships and whatnot, that might not work out well for Australia.
Dan, as always, a pleasure to talk. Thank you.